Good day everyone, I am Dela Cruz. Today I will be return demonstrating about nasogastric tube insertion.
During the assessment, first check the physician's order for insertion of nasogastric tube. Then, check for history of nasal surgery or deviated septum.
Ma'am, can you hyperflex or tilt your head upward?
Next, assess patency of nares by having the patient occlude each nostril and breathe and repeat for the other nostril.
Okay, ma'am, can you breathe using your one nostril while occluding the other?
Determine presence of gag reflex by touching the sides of the oropharynx.
Thank you, ma'am. Now we will assess your gag reflex.
Assess mental status or ability to participate in the procedure by asking questions.
Ma'am, can you tell me kung saan tuig na karon, ma'am?
2022.
How about kinsa ang presidente sa Pilipinas?
Si President Rodrigo Duterte.
Okay, so imong ngalan, ma'am?
Ako si Julina May Abasolo.
How about your date of birth?
July 4, 2001.
And then, asa man ka karon, ma'am?
Nako diri sa hospital.
And ngano kang naaga ni Daria, ma'am?
Kanang dili ko makakaon o makatulon ng tao.
In planning, identify the availability of needed supplies and equipment. Then, arrange for extra nursing personnel to help as necessary. And then lastly, prepare equipment and bring preparation to the bedside. In the implementation, first, greet client, introduce yourself, and explain the procedure in the client's level of understanding. Then, identify client using two identifiers, which is the name and the date of birth.
Good day, ma'am. I am Dela Cruz, your student nurse for today. May I know your name, ma'am? How about your birthday, ma'am? Okay, so may I know if how are you doing today, ma'am? How was your stay here in the hospital? Okay, that's nice to hear that from you, ma'am. So, by the way, I am here to inform you that I will be performing the nasogastric tube insertion. So, as ordered by the physician, I will be inserting a fine tube into your nose to your stomach. So, this is to provide you with adequate nutrition despite that you are unable to safely ingest or eat food through your mouth. So, later in the procedure, ma'am, you may feel uncomfortable or discomforted, or you may feel pain, but rest assured that I will do my best to not put you in so much pain while doing the procedure. But in case, ma'am, you feel unbearably uncomfortable with the procedure, you may raise your hand or just tell me directly, and I will have you time to relax before completing the procedure. Is that okay, ma'am? Okay, thank you, ma'am.
Then, provide well-lighted room. Next to that, provide privacy by screening and closing windows and doors. Assist the client to a high Fowler's position if his or her health condition permits, and support the head on a pillow.
So, before that, ma'am, I will adjust first your bed.
Place a towel or disposable pad across the chest. Apply clean gloves.
forward so that I can clearly check your nostrils. Thank you, ma'am.
Ask the client to hyperextend the head and using a flashlight, observe the intactness of tissues of the nostrils including any irritations or abrasions. Examine the nares for any obstruction or deformities by asking the client to breathe through one nostril while occluding the other. Prepare the tube. If a small bore tube is being used, ensure that the stylet or the guide wire is secured in position. If a large bore tube is being used, place the tube in a basin of warm water while preparing the client. Then, determine how far to insert the tube. Use the tube to mark off the distance from the tip of the client's nose to the tip of the earlobe and then from the tip of the earlobe to the tip of the xiphoid. After that, lubricate the tip of the tube well with a water-soluble lubricant or water to ease insertion. Now, insert the tube with its natural curve downward into the selected nostril. Ask the client to hyperextend the neck and gently advance the tube towards the nasopharynx. Direct the tube along the floor of the nostril and toward the midline. Then, slight pressure and twisting motion are sometimes required to pass the tube into the nasopharynx, and some clients' eyes may water at this point. If tube meets resistance, withdraw it, re-lubricate it, and insert it in other nostril. Once the tube reaches the oropharynx or the throat, the client will feel the tube in the throat and may gag and retch. Ask the client to tilt the head forward and encourage the client to drink and swallow. If the client gags, stop passing the tube momentarily. Have the client rest, take a few breaths, and take sips of water to calm the gag reflex.
Okay, ma'am. So, mag-sip ka of water, ma'am. Tapos, while nag-sip ka of water, ma'am, is i-advance na ko ang tubing. Okay ra ba na, ma'am?
Then, ascertain correct placement of the tube. Nasogastric tubes are radiopaque and position can be confirmed by an X-ray. Aspirate stomach contents and check the pH, which should be acidic. Aspirate can also be tested for bilirubin. Bilirubin levels in the lungs should be almost zero, while levels in the stomach will be approximately 1.5 milligrams per dl, and in the intestine more than 10 milligrams per dl. Historically, nurses placed a stethoscope over the client's epigastrium and injected 10 to 30 ml of air into the tube while listening for a whooshing sound. Then, secure the tube by taping it to the bridge of the client's nose. Cut 7.5 cm or 3 inches of tape and split it lengthwise at one end, leaving a 2.5 cm or 1 inch stub at the end. Place the tape over the bridge of the client's nose and bring the split ends either under and around the tubing or under the tubing and back up over the nose. Once correct position has been determined, attach the tube to the suction source or feeding apparatus as ordered or clamp the end of the tubing. Secure the tube to the client's gown. Loop an elastic band around the end of the tubing and attach the elastic band to the gown with safety pin. After that, remove and discard gloves and perform hand hygiene. Document relevant information, such as the insertion of the tube, the means by which correct placement was determined, and the client's responses.